Yeah, let's see. Yeah, I've got him.
Um, okay, it's gone. I guess 7:30 where everyone else is. It's 5:30 my time. I'll just give it another minute just in case some latecomers are coming through, and then I'll hand it over to you, Luke, to go through your presentation.
Thanks,
Um,
Sam.
in the meantime, if I could just ask everybody just to mute your microphone, just to block off any background sounds while Luke's doing his presentation. And Luke, will you be offering in between to open up questions and answers, or are you waiting for the end of your presentation?
At the end, yeah, thanks, Sam. At the end would be preferred.
Okay, good. All right, so if anyone does have any questions, you just might want to note them down as it's going along, and then you can bring them up towards the end when Luke's ready to take those questions. Right, it's got one more coming in right now, and I might just give her 30 seconds or so, and then I'll let you go for it.
Very good.
Let's see, let me just do one final quick check around the room. Okay, I think we'll make a start, Luke. So yeah, and if people come through, they'll just come in as we're going through. Let me just do a quick check. All right. So I'll just do a bit of a quick announcement. Thanks everybody for attending this presentation presented by Luke Vecchio, who's done this out of his own spare time. So I appreciate his efforts for this, but I think it's going to be a valuable information session. So I'll let him start, and then, as I said earlier, if you have any questions, note them down as he's going along, and he will open up Q&A at the end. Okay, I'll hand it over to you, Luke.
Thank you, Sam. Thank you. So welcome along, and thanks for joining us on this presentation on injury statistics and prevention in martial arts training. A little bit of the outline of what we're going to cover tonight. We'll very quickly look at some injury statistics in martial arts. We'll then touch on some of the more common injuries that we see reported in the research, such as tendon injuries and ligament injuries, and also injuries to the low back or the lumbar disc. A little bit about me. I have a PhD in sports science. My research focus has been on martial arts for the last 10 years. And I'm also a martial artist myself and an educator. And I'm responsible for creating course content that targets health and fitness professionals. Importantly, we cover topics that relate to things like strength training, bodyweight training, fitness, combat sports for health and performance, and the use of sports science for recovery. So to start this presentation, I'll bring you back to a research study we conducted a couple of years ago. And the reason we conducted this research was we were receiving a lot of reports about injuries that are taking place in fitness facilities as a result of fitness professionals using boxing, kickboxing, and other modified hybrid forms of martial arts to promote fitness. So in hearing these reports, we decided to contact a number of hospitals in the Brisbane metropolitan area, and we asked their emergency departments, what sort of injuries are you seeing as a result of somebody who's presenting after conducting some form of that type of training, boxing, kickboxing, in a fitness setting. And we're quite surprised by the number of injuries reported and the severity of these injuries. And this is purely related to trying to combine fitness with some form of a martial art or boxing technique. And when you try and combine those two things, sometimes the result isn't so good because we're trying to It asks people to work vigorously. We're trying to promote conditioning. And in doing that, sometimes we lose sight of safety and good technique. So it was this research that spurred on a lot of our education efforts to target fitness professionals, to warn them about the perils of trying to combine fitness with boxing, kickboxing, or even martial arts. And as I said, from this research, we were quite surprised by the number and severity of these injuries. So it is important to understand some of the risks that take place when you try to do this. If you're trying to promote fitness, at the same time incorporate some form of martial art. And if we look briefly at the sorts of injuries that are being reported across the different martial arts, this certainly isn't to try and pinpoint one martial art in particular. Moreover, just to report on what we're seeing in terms of the common injuries, and this spreads across the various disciplines in martial arts. But there's a couple of commonalities that you'll see, and one of which is sprains and strains. And sprains and strains obviously reflect injuries to tendon and ligament tissue. So we can see that for the jiu-jitsu, judo, and kung fu, and can also see it's common to karate and taekwondo. So it's probably fair to say, based on this research, that a presenting problem that any martial arts instructor might face is the risk of an injury to a tendon or ligament. That seems to be the most common and presenting issue or risk when it comes to participating in martial arts training. So with that known, we then need to turn our attention to, well, what sorts of exercise selections that we might be choosing could promote or increase this risk or promote injury. So certain exercises can actually replicate the mechanism of injury. What that means is that certain exercises are actually creating an environment to cause injury to a particular tissue. So we certainly want to avoid that. For example, sudden movements. So when we perform really explosive sudden movements with directional change at speed, this puts a lot of stress on ligaments. So one particular mechanism of injury we know of for ligaments is sudden directional changes with speed. In contrast, when we think about ligaments and injuries to ligaments tend to result from high repetition, heavy loads, and high impact forces. And bear in mind, you're thinking, well, I'm a martial instructor, we don't use weights, our students don't lift weights, we don't expose them to heavy loads. You do not have to lift weights to be exposed to heavy load. The body is a load. The weight of your limb is a load. And every time you move that limb, you are creating a torque or a stress to particular tissues that surround that joint. So these are important concepts to be aware of. Is what is the environment to create these injuries? How do we create these injuries in the first place? And could it be that there's certain exercise selections that increase the risk? So this brings us to another important point, and that is the concept of tissue tolerance. The capacity of your tissues, be it muscles, tendons, or ligaments, to withstand stress. We have this concept of the margin of safety. So every time a student is performing a particular exercise or particular strike technique, they are applying a stress to the tissue. And if that stress continues over time and there's not an adequate amount of recovery, there's an inappropriate load, there's an inappropriate number of repetitions performed, then what we see happen is that the margin of safety slowly but surely reduces, and then it's on the nth repetition that the person experiences pain. And that pain might be a tear in the tissue itself, a tendon or a ligament, so a microscopic tear, or it could be a complete avulsion injury where the ligament or tendon completely snaps. So that concept of tissue tolerance applies to our soft tissues like tendons and ligaments. And we've always to be mindful that the load that we put on our students when they can, doing physical activity, they're performing their martial arts routine, and keeping in the back of our mind is this an appropriate number of repetitions for them to perform? Is it an appropriate intensity, volume, and are they getting enough rest between sessions to make sure that they maintain an adequate margin of safety. So if we now turn our attention to one of the more common tendon injuries, is the Achilles tendon. So the Achilles tendon, of course, connects your calf muscle to your heel, and it enables walking, jumping, kicking, being one that's specific to martial arts. Now, the Achilles tendon, in terms of how it tends to get injured and the common way we see injuries present, it's as a result of high impact activities in combination with repetitive stress. Okay. So the key is understanding prevention. How can we make sure we're not exposing our students to one of these common tendon injuries, such as Achilles tendonitis? So we need to understand the role of the tendon here. So the tendon's job is to transmit force created in the muscle to the bone, making the joint and limb movement possible. Now, tendons are pretty tough. They can tolerate an extreme amount of tensile force, and tensile force is when a tissue is pulled at either end. So it's the extension of a tissue, that's tensile force. And we see, or we will experience tensile force in ligaments when we perform movements like kicking and jumping, for example. They'll put a lot of tensile force on the ligament, in particular the Achilles tendon. Now, of course, one-off repetitions of these types of movements usually are well tolerated. However, it becomes problematic when they're repetitive. And we then start to see small microscopic tears in the tendon occurring after each repetition, and there's not enough rest. There's lots of other factors, but they will become damaged from this repeated stress. And it's not surprising to know that up to almost half the injuries reported across all sports, not just martial arts, do end up affecting tendons. So it's common to see tendon injuries. We saw on my previous slides how tendon injuries were quite common across a range of different martial arts disciplines. So it is important to understand these mechanisms. Now, I'll give you a practical example to try and impress upon you the importance of understanding repetition load as it results to striking, let alone other exercises that we might have our students do as part of a warm-up, or we ask our students to do certain exercises as part of their fitness and conditioning component of your class. But when it comes to striking in particular, we shouldn't underestimate the load on tissues. By way of example, what you can see on this slide is some data from a tracker, a punching tracker. So this is a small accelerometer. It fits in a glove, and it actually is able to count the number of strikes thrown in a session, in addition to the speed and the intensity of those striking motions. What we need to appreciate when it comes to, say, upper body strikes, such as punching, that the weight of your arm is approximately 5% of your body weight. So for a 70-kilo individual, that means every time they throw a punch, they're having to tolerate 3.5 kilos of load in the shoulder joint. 3.5 kilos just for one punch. Now, in this example, you can see how many punches were thrown across just a 5-round session on a heavy bag, so 5 by 3 minutes. At the end of those 5 rounds, the individual had thrown over 1,000 strikes. Now, let's put that into perspective. That 1,000 times the 3.5 kilos means that those few minutes spent, or those 20 odd minutes, I should say, spent hitting the heavy bag has resulted in 3,776 kilos of force on the soft tissue around the shoulder joint. So, of course, in a typical striking session, they're not just going to stop when they hit a heavy bag. They might be doing shadow boxing or shadow sparring. There's all sorts of other activities. So that is just a small snapshot, and just to highlight how much load is on your tissues when you perform strikes. So your limbs create load. They create a torque to the joint, and the soft tissues like the ligaments and tendons have to absorb those loads. So in one particular session in that short period of time, that's a lot of force to contend with for the soft tissues. So it does create substantial load. Don't underestimate the load that your body puts on your joints, or body weight exercises for that matter as well. And it certainly highlights where technology can start to help us. So technology that allows us to actually quantify training load. The scenario that I often put to instructors who are wanting to use some form of martial art as a fitness modality is, well, if you were dealing with a runner, you wouldn't tell someone who's starting out on a running program on their first run to go out and try and run half a marathon or even run 20 kilometers. We understand that 20 kilometers represents volume and load. That would be a lot of foot impacts for an individual who hasn't run before. However, in martial arts and in combat sports, we haven't yet really addressed this concept, in meaning we don't really pay a lot of attention to how many times they move their limbs in a session. We certainly don't quantify it by calculating the repetitions they performed. So it's very easy to overshoot the mark in terms of, well, is this the right dose for an individual who's presenting with a low fitness tolerance? They're being sedentary, they're coming to a martial arts class for the first time, and they're going to try and keep up with everyone in the class and throw the same number of punches and kicks and various strikes. It's just exactly what's that doing to their soft tissue, and how close are we getting to reducing their margin of safety? Something to think about. So with that in mind, and considering the Achilles tendon, what are the types of movements we should be careful of? Well, the first one is jumping, repetitive jumping. Now, don't underestimate the concept of jumping. Jumping can be hops. Jumping can be skipping. It can be burpees. There's a lot of martial arts instructors who like to use burpees as a form of either punishment or even fitness and conditioning. Tuck jumps. There's lots of ways we can jump. Kicking is jumping, particularly kicks where they're coming up onto the tips of their toes on their support leg. So kicking is a form of jumping, okay? So every time we jump, we're putting a fair amount of stress on our Achilles tendon, and this strain will lead to microscopic tears. And if there's not enough recovery, or you're getting them to do too many jumps, you're exceeding their margin of safety, or you're asking everyone to do the same number of jumps, but not everyone in the room has the same level of conditioning, you're exposing them to risk. So with these higher impact activities, the key is ensuring adequate rest and recovery between sessions. So if they're coming to a martial arts class on consecutive days, and they're doing the same consecutive routine where there might be jumping, kicking, or various other forms of it, by the end of the week, they've accumulated a lot of load, which they might not be able. They might recover from it in the first few weeks, but over time, those tears and the ability of the body to heal those tears will outpace the tears. The accumulation of tears will outpace, I should say, the body's ability to heal. And when that happens, we see injury, particularly to tendons. So let's look more closely at an example. Jumping, we can see here, jumping exposes the soft tissues to 9 to 11 times body weight load. So think about, let's say, a heavyweight of someone who's 100 kilos plus jumping. 100 times, they're not, we're seeing massive amounts of load. And that's relative to someone who's lighter as well. So 9 to 11 times their body weight in each jump, or each hop, or each skip, or each body weight, each burpee. And that load is being absorbed by the tendons, particularly the Achilles tendon. So these are very, very big loads, and that will reduce the margin of safety for the Achilles tendon and that tissue over time. So what should we do? Does it mean we ban any form of jumping? No. And there is a saying that's not really a case of a dangerous exercise, but perhaps poor supervision or inadequate supervision is usually more the culprit than the movement itself. So what are the things we can do to mitigate the risk if we are using high impact exercises like jumping? But you can see in this graph here as well, it's not just jumping that imposes load to the soft tissue. Even movements like squatting and lunging impose forces up to 6 times body weight for a lunge, and a squat can be very high as well. Now, a squat can be a stance. In martial arts, that could be someone sitting in a low stance, for example, a fighting stance. So every time we put people into a position or we ask them to do movement, there is a load to a particular tissue that we need to be mindful of. So first things we need to be mindful of is one, balanced training loads. Okay, that means that there needs to be a combination of higher and lower impact movements to allow the joints to recovery. Don't perform the same movement every session. Variety is very important. Progressive overload. Okay, so if someone's never jumped before, done squats, low stance work, of course, the common sense principle is to allow them to adapt progressively over time by doing a smaller amount and then gradually building up. One very important thing that everyone can benefit from is strengthening their tissues. So getting the tissues as strong as possible. Injury resilience is key to the longevity of any martial arts student. And the best way to be injury resilient is to increase the strength of the tissues. And that might mean making a referral to the appropriately qualified person to put that student on an adequate strengthening program. Another important way that martial arts instructors can understand risk and reduce the risk is be aware of the actual guidelines for jumping type exercises, and these are known as plyometrics. So plyometrics is a term that describes explosive body weight movements where there is a rapid lengthening of our muscles followed by a very explosive contraction of our muscles. That's known as the stretch shortening cycle. So plyometrics have very specific guidelines. You should be aware of these guidelines if you use any type of plyometric exercise. Kicking is a plyometric as well. And lastly, pay attention to movement. One of the best lines of defense is actually screening someone's movement before or whilst they're doing it and knowing when to stop them, even if they haven't performed the requisite number of repetitions. So you might be asking a student to perform a certain number of repetitions, or the class might be doing it perhaps to a timer. If you know what to look for when it comes to movement competency, that can go a long way to preventing an injury in the first place. So we call this screening movement or movement competency. Do they have the competency, the structural integrity to perform that movement like a jump without being at risk of injury? And I'll give you an example of what that looks like. So what we can see here on this slide is a assessment of somebody's jumping skill or competency. Okay, so this is published by a researcher named MAIA, who actually created a protocol to assess jumping competency. Is this person safe to be doing jumping exercises? And a couple of things that stand out on this image are, like image number 1, look for the knees. What are the knees doing when they land? Because a lot of people look at what's happening when they jump, but they don't pay attention to what's happening when they land. Landing is more important than the jumping. Because it's when we land is when we're exposing our joints to those forces. And just like a BMX bike that goes over a jump with a bent frame, they're going to have a hard time absorbing the impact of that going over that jump if their frame is bent. So we can see here on these images things to look for that identify the incompetent mover, the incompetent jumper. And these subtleties make a difference, because if you stop that person from doing the exercise the moment you pick this up, you're possibly going to prevent an injury even there and then. But if it's not picked up, they're not attentive, then they continue to perform jumps with the knees that cave in as they land, and it's only a matter of time before they end up with a serious injury. Now, in terms of how much jumping we should expose people to, well, these are the plyometric guidelines that I spoke about earlier. So, for example, somebody who is a novice coming into your martial arts class with a low fitness base should not perform any more than 80 to 100 foot contacts in any one session. So we could break that up and think, well, if I ask them to do 10 jumps on the spot, that would create 10 foot contacts. So we can get an idea of what that might look like, a tangible, more practical sense of what 80 to 100. But these actually guidelines are here to remind us that not everyone qualifies for every particular exercise that a class might be doing. And that is a low and more on the lower intensity side. So if we do something that's very, very high impact, like multiple jumps, so hopping across a room like a kangaroo type jump, that moves from low intensity to say high intensity, then that number comes down by half. So it's an inverse relationship to understand. The higher the intensity, the lower the number of repetitions in any one session they should perform. If you exceed these guidelines, you're increasing the risk of injury. Now, that would apply to something like a burpee, another common exercise used for fitness purposes. So whether it's a burpee, a hop on the spot, various forms of jumping and even kicking, these guidelines remind us that every tissue has a certain tolerance. And when we exceed them, we are increasing the risk of injury. So now let's turn our attention to ligaments. So again, the anatomy of a ligament. So ligaments connect bone to bone. So remember, tendon joins muscle to bone. Ligaments connect bone to bone and help stabilize our joints. Like a tendon, we can create microscopic tendons in this tissue over time from repeated stress, common with sudden directional changes, for example. So we see that ligament injuries are very common in movements where there is sudden directional changes. So that could still translate to something like a sparring scenario where they're being evasive. That is an example of a sudden and explosive and fast directional change. And that's where we can see ligament injuries. So any high dynamic movement, high intensity drills, we need to emphasize proper technique at all times and be aware of our base conditioning. So in terms of ligament, what is a controversial exercise that we should be aware of? Well, a squatting motion. Now, deep squatting, so getting somebody to squat to the point where their glutes, their buttocks are below the horizontal line or the 90-degree angle at the knee. So this far image here represents a deep squat where we're breaking that imaginary horizontal line here. So as we go deeper, we do expose the knee joint to more forces. Now, this might be relevant for movements or sustained postures like, again, I come back to the example of a low stance or a very deep low stance used by various martial arts. Now, typically a healthy knee will have no problem going low. So that's the good news. So if the individual, your student, hasn't got a history of knee injury, ligament injuries to the knee, allowing them to squat below the 90-degree baseline is fine. That is not going to cause any problems to their knees. However, if they do have a history of knee injuries, it would be prudent to restrict the range of motion in their squatting activity. So exercise caution for any student who's had existing knee injuries when it comes to repetitive squatting. So using the squat exercise as a warm-up is pretty common to many martial arts. As part of the warm-up, having students do repetitive squats. The depth of their squat should be based on their competency of movement. And that looks like this. So here's a good example of an incompetent squat on the left, where we can see the knees, the position of the knees aren't controlled. They're tracking too far forward. They're not sitting flush on the base of their foot. They've come up into their toes. Back isn't straight. That doesn't help either. Now, ideally, we like to squat controlling the position of the knee. Now, if we could flip this image front on, we would apply the same movement screening logic to we did in the jump. We'd also want to make sure the knees aren't caving in. So if I come back a bit, if we're doing repetitive squats and the knees look like image one, that is not the sort of squat that's going to be healthy for the knees. It's actually going to be detrimental and create excessive forces on the knee ligaments. So repetitive squatting is okay if they have healthy knees. If they've had a history of knee troubles, it's advisable that you restrict the range of motion in that squat. Not going all the way down is a good idea, and making sure they control the position of the knee relative to the toes. And if you're interested in the discussion around the squat in general, is it a safe exercise? And I encourage you to read this position stand by the National Strength and Conditioning Association. And I can put some links up after this presentation. But I will finish in saying this. When performed correctly with correct alignments, squats are not only safe, but they can actually deter knee injuries because they do strengthen the soft tissues around the knee. So if they're supervised appropriately, the joints maintain correct alignment, then going past the 90-degree and going into a deeper squat can actually be beneficial for the knees. But when there's been a history of knee injuries, that changes. And the key is always appropriate supervision. So our third exercise that we will look at, or the danger of certain, is eddy striking activities. So this does flow back to our research when we looked into a lot of the injuries that were happening in fitness facilities with fitness professionals allowing their clients to strike an implement in a kickboxing scenario or a boxing. We saw a lot of the same injury, and we still see it to this day when we educate fitness professionals. We even get them turning up to the course with these injuries. So whoever's teaching them hasn't been correcting their technique and advising them on adequate safety practices. But the common mechanism of injury to the hand when we strike an object, now this could be a hand pad, it could be a heavy bag, anything that you're striking, the risk is that the soft tissues to the hand, when the hand isn't properly aligned. And one of the hardest things that we can do to the hand, or one of the highest stresses, I should say, that we can impose to our hand and wrist, is to punch with the wrist bent, extended wrist. Okay, so when the wrist isn't held straight, bent. So they're hitting with a bent wrist, they're replicating the mechanism of injury to the soft tissue called the triangular fibrocartilage. And that is an important ligament that stabilizes the hand. Okay, the triangular fibrocartilage stabilizes the hand and wrist. Very, very important. It's commonly injured when people cock their wrist when they strike an object. We actually see this injury happen a lot to people who fall on an outstretched hand. So you see a lot of the incidences of a triangular fibrocartilage when people fall into an outstretched hand. And the other techniques that generate a lot of injury, of course, hooks and uppercuts. Now, that might not be specific to a lot of martial arts who don't use hooking punches or uppercuts, but they're quite difficult techniques to do well because of the requirement to align the knuckles. And what tends to happen when people hook and uppercut is they cock their wrist. And we can see here, so this is just an image of those ligaments that stabilize and protect the small carpal bones of the hand, and they're easily torn when individuals strike objects with incorrect technique. And that really relates to not using proper hand protection. Okay, proper hand wrapping techniques and protection. The use of appropriate protection on the knuckles. And probably the biggest cause, though, is allowing people to strike with incorrect technique. And this is where the blend of fitness and conditioning can go wrong. When you're trying to get people fit, and your method to get people fit is hit an object and let's hit it as fast and as hard as possible, because you need to get a workout. We need to get this person fit. So the more they do, the better, the harder. the problem with that approach is, and I can draw parallels here to activities like CrossFit, which has improved a lot over the years now. But initially, when CrossFit came in, they tried to combine conventional gym exercise with fitness, tried to make it a competition. And in the effort to try and perform the most amount of repetitions, lift heavy weight, technique went out the window. And we saw a lot of injuries, a lot. That was in the early days. Now, kudos to CrossFit. They've improved that. There's much better coaches, much better systems in place, and we're not seeing the severity of injuries or the incidence of injuries that we did early on. But we can definitely see that happening whenever we try to combine getting people fit, getting conditioning into a session with an activity that requires technique. Getting the two to coexist isn't easy. I will say that if we're thinking about safety. It can be done, but we need to be aware that when you try and pursue effort and intensity, usually the sacrifice is technique. And now lastly, we'll look at the low back. And our last component of the presentation is the low back. So here we'll focus on the lumbar discs. So high impact movements, anything that requires the spine to absorb compression. So we'll see a lot of pressure in the low back or the lumbar discs from jumping, for example, but it's not just jumping. Any high impact movement place significant stress on the lumbar discs. So there is absolutely a need to be aware of what sorts of loads go into the lower back when we perform various types of conditioning exercises or exercises in general. Now, to understand some very basic spinal mechanics, that our disc sits between two bones called a vertebrae, and the job of the disc, of course, is to help with load absorption, okay, and to help create movement. Now, when we move our spine in various directions, we mitigate and we move the stress. The stress gets applied to different parts of the disc. So by way of example, if I lean back, if I'm doing a movement where I'm leaning back, I'm extending my spine and I'm putting more pressure on the disc here. So we're seeing that pressure get mitigate to the back of the disc. When I move to the side, we can see the pressure moves to the side of the disc. And when I move forward, such as bending down to touch my toes, so think about that motion, and that gets replicated in things like stretching. So a very common way that we flex our spine is when we perform toe touch stretching. So to try and stretch the hamstrings, we often tell people to try and keep your knees straight and touch your toes. We can do that sitting down or standing up. Well, when we do that, we're actually flexing the spine and we're mitigating pressure towards the back end of the disc, and that can push it towards the spinal nerve. So it's this particular motion, spinal flexion, that we have to be aware of, because spinal flexion replicates the mechanism of injury or a disc bulge. So when someone says I've got a bulging disc or a disc herniation, these are some of the more clinical terms for this injury. The usual way that occurs, and let me be clear about this, is through repetitive spinal flexion. So that could result from repetitive toe touching, for example. It could result from weeding. Someone who goes in the garden and spends the whole day weeding, then comes into a martial arts class the next day and performs more spinal flexion through excessive number of toe touches. Or another common exercise that we see in martial arts is the sit-up. This has been used for a long, long time. This historical exercise for strengthening the abdominal muscles and the trunk muscles. Sit-up. Sometimes it's even combined with punching motions like we can see here. Now, what we need to be aware of is, firstly, when we do a sit-up, we're causing the spine to flex. We're creating spinal flexion. Okay, so a sit-up flexes the spine. Now, the problem with flexing your spine in this manner is the amount of pressure it puts on that tissue. Now, when we do one sit-up in poses, 3,000 newtons of pressure to a disc, and that might not mean a lot to many people, and that's completely understandable. If you're not in the field of biomechanics, you wouldn't remember or even know. But what's significant about that 3,000 newtons is that is the safety limit that occupational health and safety institutes tell us that is the limit of safety for someone's spine. So we often see that there is a restriction on how much weight you can lift in a workplace. And the reason there's a restriction is because the weight that you lift can approximate this sort of pressure, and that sort of pressure will lead to an injury. One sit-up, let me repeat this, every sit-up you perform is imposing 3,000 newtons of pressure on the spine. So essentially, asking someone to sit up is like asking them to pick up a 20 to 25 kilo box. And we tell people not to do that in a workplace because we know that that 20 to 25 kilos is going to approach that margin of safety. And if we go back to my earlier graph, we look here, that red line is the 3,000 Newton red line. One sit-up, as you can see this part of the graph, is actually exposing that individual to a load that exceeds the tissue tolerance of the disc, the intervertebral disc in the lumbar spine. One. So if they did a whole bunch of sit-ups, then they're finishing that class and their disc and spine's been exposed to a load that could provoke pain and injury. Now, the common rebuttal to this, is, well, I've been doing sit-ups for 20 years, I've never had a back pain. You're probably an outlier in a normal distribution. So genetic factors, like everything else, some individuals have greater tolerance to the number of times they can flex their spine before they get some sort of injury or pain. Not everyone is on that, in the middle of that bell-shaped curve. You might be an outlier, or that person who says, I've been doing sit-ups my whole life. Just like a number of people smoke their whole life and they don't get cancer. If we've got 20 people and ask them to run across a busy road, a couple will get across. Most people will get hit. So performing sit-ups is creating that sort of context. And it is not an advisable exercise to use to strengthen the abdominal muscles, given the risk. So the risk versus reward. The risk is every sit-up is reducing the tissue tolerance, reducing the margin of safety, and moving closer and closer to some sort of pathology in the back, injury. Is there other ways we can strengthen the abdominal muscles? Yes, there is. That don't involve flexion? Yes. So it's certainly worth weighing up the risk versus reward. So to summarize this short presentation, understanding the mechanism of injury can help in selecting safer exercises. Gradually increasing the intensity and duration can prevent injuries, absolutely. The concept of progressive overload certainly applies. And that is strongly supported by the need to support proper form and technique, even when it comes to just fitness exercises for the purpose of improving fitness and conditioning. And lastly, but most importantly as well, be attentive to how much rest and recovery your students are getting between sessions. And with that, I'd be now happy to open up to any questions.
So does anyone have any questions that they want to ask Luke regarding what was presented tonight? Feel free. If not,
I'll try one. Hey, thanks for the presentation, Luke.
Welcome.
A couple of questions I've got is like, you mentioned the one with the when your wrist is not straight and you're hitting the bag, or you can cause some damage because the wrist isn't straight. Is it the same risk if, say, people are doing clapping push-ups?
It could be, absolutely. So if we think, Will, the common way that we see injuries like a triangular fibrous tear is someone falling into an outstretched hand. So if we're doing a clap push-up, we're going to land with our wrist extended. That's wrist extension, right? That's neutral. So a clap push-up is potentially putting a large amount of stress on that ligament. or those ligaments that stabilize the wrist and the small bones of the hand.
Okay.
Yeah,
Second.
I would add to that. A plat push-up is probably one of the more higher intensive forms of a push-up. It's a plyometric one, and it's very intense. So what we're talking about with these exercises and previous presentations is about risk management. So you want to be very mindful how you would apply that particular exercise.
I guess the other one was like, I appreciate the dangers associated with, say, doing uh, sit-ups. Any thoughts about what is a safer alternative?
Sure, absolutely. Look, the quickest and easiest answer is your variations of a plank, because in a plank, you're obviously holding a very straight spine. You're not flexing the spine. So sit-ups could be replaced with planks, and that would go a long way to reducing the risk to the lumbar spine and lumbar discs. Would reduce the number of times they're flexing their spine. But at the same time, and importantly, of course, a plank does target and will strengthen the abdominal muscles. So you'll get the same, if not maybe a better result, but with less stress to the spine.
Right. Thank you.
Dr. Luke, I just want to thank you very much for giving us all your great time.
No problems, Graham. Always happy to. Feel free to reach out. I know sometimes it's like the post-mortem. You'll think of a question maybe half an hour down the track or an hour. So I'm more than happy to respond to emails if you've got any questions.
Thank you.
Yeah, as I said, the main thing is that I think what we're seeing now is we've got this cross-pollination going on where we've got fitness professionals trying to use hybrid forms of martial arts for fitness. And on the other side, we've got martial art instructors who incorporate some elements of fitness. So the idea is that a rising tide raises all boats. So we want to get the education out there to make sure everyone's doing it in a safe and productive way.
And can I just add, Luke? Hi everyone, I'm Hayes. I'm Luke's colleague. We founded this business together, and it is very challenging for lifetime martial artists sometimes to accept the evidence. I struggled. And how many thousands of sit-ups and push-ups we did over the years with our members to ourselves. But it's been the best thing, applying some of these exercise selections, understanding to my members. Ultimately, we are effectively competing in essence with the fitness industry, and we want people to train in martial arts. And if we can show a level of duty of care and making sure we're ticking all the right boxes, we want people to spend more time doing martial arts than just going and joining a group fitness class at the gym. So it was hard and still is hard sometimes. However, your clients will thank you in the end. And ultimately, our programs that we build were originally for the fitness industry, but we really want to educate the martial arts world, which is our passion, in safe and effective exercise. So if you're really interested, please contact us offline, Luke and I, and we've got lots of video content, how to progress and regress clients and push-ups and planks, simple videos to follow. Let us know. We're happy to help out the industry because we're part of the martial arts industry. That's all I want to say. And thanks, Luke, for your presentation. Well done as always.
Great, thanks, Hayes. Tash, you have a question? You can unmute your mic. And in the meantime, Luke, I don't know if you've got your email address up on any of these slides. If you could bring that up in case anybody needs to write that down, or you can just mention it at the end.
I'll put it in the chat box and they can just copy it. So I'll just type it.
I think the next slide, Luke, did you have?
Oh, sorry. Thanks. There you go. Is that it?
There you go.
Yes, that's it.
Go ahead,
Hi,
Tash.
guys. Hello. I just wanted to check the exercise danger management manual you referred to earlier was 2011. Is there anything more updated, like a newer version at all?
Not that I'm aware of, Tash. I think it's a good question. I did look. I haven't seen an update to that for a while. One thing's for sure, that science moves pretty quickly these days. The quantity of research that gets done on I guess what we knew a year ago can change, very, very quickly. And there is a saying, nothing's certain in science. So what we know today could very well change 5 months, 6 months down the track too. So it isn't always easy without actually reading and doing literature reviews to keep up best practice and current knowledge.
Yeah, I'll just add on to that, Tash, as well. We're also looking at updating that document, that exercise danger book. But as Luke mentioned, the progress is quite rapid. So by the time we put out a new document, there'll be changes to that as well. So it's really hard to keep up with all the updates and changes. But I think the point of what this presentation is, what Luke was trying to mention, is that if we can all keep ourselves updated with current information at our own pace and just do the best that we can. But yeah, we are still looking at making an updated document of that. Stephen, you have a question? You've got your hand raised.
Yeah, thanks, Sam. Thanks very much, Luke and Hayes. Really useful presentation. I've got two questions. One on the sit-ups. What are the safety implications of something like a leg raise as an abdominal exercise? So with the
I know the one you mean.
Position, either both legs or alternating legs.
That actually is even harder on the spine, Stephen. And what I'm doing is I'm quoting data from a professor of spinal mechanics. His name is Stuart McGill. And Stuart McGill really is the leader in this space. All his research, like for example, how we learned about those lumbar disc bulges. He took human cadaver spines, put them in a machine and bent them, and they counted how many times they would bend before the disc would actually literally spit out. So they did very detailed, high quality research. So I have full confidence in anything he reports on. And back to your question, what he showed is those leg lowering exercises are actually quite hard on the disc and hard on the spine when it comes to actual compression. So that's that sort of jamming of the joints. So if the individual is well conditioned, they haven't had a history of lower back pain, they're fit, they're strong, healthy, and there's a need for them to do it. So if it was a competitive athlete, like someone fighting, they need to perform these high-risk exercises because they need to develop such high levels of tissue tolerance in their trunk muscles because they've got to absorb strikes. So sometimes we need to move into those high-risk areas if we're in this performance space. But if we're not, we're just dealing with the Mr. and Mrs. Joneses of the world who are coming into a martial arts class to get fit and healthy, stay fit and healthy, then there is safer, better selections we can make to improve the strength in their core muscles.
Yeah, well, as someone who bulged 3 discs walking the dog a couple of months ago, I can certainly appreciate the need to look after the lower back. It's been a very disagreeable surprise. So thanks for that. The other question I had is, how much does anything in this, or how much, if at all, does anything in this presentation change when we're dealing with junior age groups in particular? So I've got age groups from 3 up to age 60, particularly in those, the primary school age and the high school age. Are there any extra considerations that I should be thinking about?
That's a great question, and it's also a hard one to sort of summarize quickly. I think if you follow the principles of progressive overload, careful observation of movement, and graduated difficulty, so making sure that they're competent at something first before you give them another challenge, they're the most important principles you could apply at any age. Okay.
So in kids, it's probably a matter of trying to rein in their exuberance in order to get to doing,
because they will do a lot. They will be happy to do 30 jumps and turn your back and they're doing 40. So, and then before you know it, they've exceeded some of those guidelines, and those guidelines apply pretty much across the age spectrum. So that would be my advice. And it is a great question, and probably one that deserves more attention, but a bit hard to address in a short period of time.
No worries. Thanks very much.
Great, thanks, Steve. Does anyone else have any questions before we close off this session? If not, I will just thank Luke again and Hayes that spent time and energy to present this informative session for us. I will also add on to that, we will also be looking at doing another presentation in the next couple of weeks on the topic of stretching and flexibility. So You might want to keep an eye out on that. So hopefully that will be coming up in the next couple of weeks from another one of our members presenting that one. Walt will send out the necessary information once again. This presentation will not be available online anywhere, but I have recorded it just for safekeeping in case Walt does decide that he wants to release it. So that was the next question somebody put up. Other than that, Luke, do you have anything else you want to just finish off to say, or are we all everybody happy to close out tonight?
No, as I said, we just really want to see a rising tide. So hoping we can help promote safety in the industry and see martial arts flourish and become part of an option for people to better their health. Fantastic.
Great. All right, then, everybody. Thank you for your time. Thank you for Luke again. Well, as I said, we'll keep you updated with the next presentation regarding stretching and flexibility. Thanks, everybody. Enjoy the rest of your night, and we'll hear from you soon.
Thank you.
Thank you.
Sam? You there, mate?
Sorry, Hayes, are you asking for?
Yeah. I just want to speak. Sam, so I just wanted to catch up with you quickly. I came in late.
Yep.
I was just thinking, basically, we've got all hundreds and hundreds of hours of videos, right? So potentially have a chat to Walt. We could easily compile with our online platform something like how to progress a push-up, a plank, a squat, all that stuff into a specific one login platform at a low cost, just putting it out there. We've just got to compile it. We can white label it, but it might make your life a lot easier, their life a lot easier. If a certain franchise wants to go different, like a big martial arts, we can do it for them as well. But I think the issue a lot of these guys are going to have is accessibility.
Yeah.
Like the book, updating a book is not going to cut it. But what we do, our company is designed to keep shit up to date. Videos, we remove, we reference. So our role in the fitness and exercise physiology world is to take education away from personal trainers, gyms, and we look after the education front. So have a think about it, happy to chat further, but we've got it all, and we can work on assessing them or not assessing them, making it a library, whatever. The more of these people watch this stuff, the better it's going to be, the less dramas, because how many of these guys are going to stop doing sit-ups tomorrow?
Yeah, no, exactly. Yeah.
But if you have, instead of sit-ups, click here, this. Push-ups, the load of a push-up, you get someone that's overweight, a female or a male doing push-up, even on their knees, is 55% load on their shoulder joint. So what do? How do we regress them? We've got the steps. So we can dumb it down without all 50 courses. I'm willing to create one system, one click. We offer it at a low cost. We don't even have to assess them. Assessing them would be great, but you might get a bit of, no, I'm busy. At least we can have an online platform created. I'm happy to do a Zoom with you and Walt and show you what it looks like.
Yeah.
We'll do it low cost. If you guys want to put a piece on there to collect some funds, that's okay. I'm a businessman as well, but the fitness industry are doing it and they're paying a lot more. Luke and I have just said we're happy to do it a lot cheaper for the martial arts world because that's where we're from. We're originally martial artists, man. So
yeah,
have a chat about it. Let me know, but it can make life a lot easier for a lot of these schools, especially the big ones with 20 schools. Like you can have, like even with me running my own martial arts academy, there's 5 instructors. Mate, sometimes they'll just go into their own little world and start doing shit they're not supposed to because they're trying to get creative. Part of my onboarding, if you want to be an instructor here, you've got to do our courses.
Yeah.
Like putting aside, I don't care if you're a fucking PT, you've got to do our courses in safety. And like, I'm old school, but I'm new school as well. I get it, but all I'm saying is we want to help the industry.
Yeah.
And it's there for the taking for you if you guys want to go to that next level.
Yeah, no, cool. That sounds good. So what you propose, you've actually got something already, is that right?
We've got hundreds of hours of video content, like
Okay.
push-ups and planks.
Yeah.
We've got a course already on push-ups and planks.
Right.
Pull-ups, but we can create things that are specific. Like not many people are going to do pull-ups at a martial arts academy, but they're going to do push-ups and planks and squats.
Yeah.
And plyometrics. That stuff we can plug and play.
Okay.
You know,
Okay.
stretching, how to use a fit ball. Like we've got, I know martial arts gyms have fit balls.
Yeah.
There's some stuff there. Luke and I can brainstorm with you. What do you want in it? We just plug it in. If we don't have it, we film. We get Dr. Luke to film it, because what that does also is they watch that stuff. It helps in the long run with insurance that they're doing the right thing. That's why ultimately, if we can quiz them, it's better, but at least give them access and exposure. And the good martial arts schools will do it. If they're going to pay $50 or whatever it is to get access to this per instructor, so be it. That saves them a hell of a lot. Like we charge $300-400 per course to the fitness industry.
Mm-hmm.
But we can create something that's going to be easily adaptable. As long as we cover our costs, you can add some cost to it. We can white label it with MAIA, with us. I don't care. I don't care. We can white whatever. We'll just make it work, and we can have a brainstorm. You, Luke, Walt, myself, and get it done properly. And then we're the ones that update it.
Mm-hmm. Yeah. Yeah. No, that sounds good. Yeah. Okay. I'll bring it to Walt to his attention and see what he says.
Basically, to make life easier for everyone, and you guys can work out how it fits in the ultimate model. It could be even it could be something you can even fit in part of the accreditation, mate. Like if we make it, let's say we create a module that's not assessed, that's $100, part of the accreditation, and they've got lifetime access to it. That's a valuable tool. That's a valuable tool. They've got videos, and we can push out reminders. Have you watched this? It's simple to do. We build it. We built it. It's not. That's what we do as a business. It's not what MAIA do as an organization. Is film content. That's what we do every day. We run courses face to face around the country, in Asia. So it's there for the taking. We'll have a brainstorm. Anyway, I just wanted to let you know, man. That's all.
Yeah, no, that's good. I mean, it was going to be a follow-up question that Walt had. On that, were you seeing it as an online course that they would do self-paced, or would it be an interactive thing?
The online program is all videos. Click, click, click. But we've got printouts as well. So, for example, progressions for a push-up, there's a PDF. They can print that off and they can go to a client. But we've also got in those modules interactive. We can assess them if you want to make it interactive. We can assess them. We can even make them. It depends how deep you want to go. Submit videos to this online platform. But ultimately, think about the martial arts masters out there. Everyone's a master. Not everyone wants to be assessed on their video techniques, their push-ups. I'm saying, let's get the videos out of them. All the exercises that we know pretty much that they do within scope. Make it very clear they shouldn't be doing barbell unless they're a personal trainer. We can do this on the one platform.
Okay.
Anyway, we've got a lot of data. We've got a lot of information. We can add to it very easily, and we've got the evidence behind it. So,
yeah. Okay. Cool. All right. Let me take that away, and we'll get back to you and see what we can come up with. Yeah.
All good, mate. Nice to meet you, mate.
Yeah, nice to meet you too. All right, thanks for your time, Hayes.
Bye. See you soon.
I'll
Bye.
see you then.